let's go ahead and get started. Again, appreciate everybody being here. David starts again with Corporate Strategies and Mary Filardo, National Council and School Facilities, doing our weekly conversations as usual on this season right now, looking at some policy implications for K12 post-pandemic. And we're very grateful this week to have Dr. Richard Shaughnessy on with the University of Tulsa. And what we're going to do is we're going to spend a lot of this time today in Q&A with Dr. Shaughnessy. We've discussed last week, Jerry Roseman on the call with us again, helped frame up some conversations about indoor air quality and condition assessments and sort of the end state, the user's view and lived reality of some of these data points that we're finding and some of the implications of capacity and the user experience and sort of the operations of a building from applying some of those standards. And so we drafted some standards and ideas for thresholds of acceptable CO2 parts per million, for example. We drafted some ideas about relation of capacity to air filtration. And we're gonna just posit some of those questions to Dr. Shaughnessy and engage in some conversation. I hope you brought some of your questions as well, and we're just going to get right to it. So for those of you who don't know, Dr. Shaughnessy at the University of Tulsa serves as the director and research manager of the Indoor Air Quality IAP program at University of Tulsa since 1987, and is internationally known for his work in IAQ, homes, schools, and workplaces. And has done research on the impact of IAQ and academic performance, and that's something, of course, we want to touch on. And has served as the president for ISIAC, the International Society for Indoor Air Quality and Climate. So, Dr. Shaughnessy, again, thank you very much for taking time out of a very busy schedule. And if it's okay with you, sir, we can just go straight to some of the questions, unless you wanted to kind of give a sort of introductory overview comments to get us started.
No, I mean, thanks, David, for the invitation today. We've here at the university, we've been kind of charged with and looking at implications of COVID in schools throughout the United States, and working with the EPA, doing webinars, outreach, everything on, it's a multifaceted type of approach that we've got to take. So you've got to, ventilation is one very important component. And of course, there are other complementary approaches. But I'm glad to be a part of this. So.
Yeah, thank you. So one of the first things, and I'm just going to go as usual, folks, I'm going to just start going through some of what we've already talked about to frame the conversation with Dr. Shaughnessy, but please fill up that chat box with comments, questions, and then I will field those as well. So what we're looking for, and again, sort of the reason that we're having this conversation is a year ago when we started looking, Mary Filardo and I, who's on the call with the National Council and School Facilities, started looking at state level guidance coming out, and then federal guidance. It, of course, has changed so quickly and so often and been, quite bluntly, very vague a lot of the time in terms of difficult to find specific, actionable, operational implications of the guidance. If this, then that kind of logic. And so we are now, after meeting regularly, since last April to talk through some of the concepts, trying to come up with, once the pandemic is over, once we start to get back to normal, what can we learn from what has been an extraordinary year? And from an indoor air quality perspective, from a building conditions perspective, what can we learn without overreacting? And what can we apply without, digging our head in the sand, the two opposite things we're trying to avoid. And so what we're looking at in terms of discussion is through several folks that we've spoken with in different disciplines, CO2 levels as a proxy for air quality has come up several times as a decent, not perfect, but a decent instrument to approximate indoor air quality. And I think you and I discussed that briefly, but generally speaking, do you think that's a good metric to use as an approximation for IAQ?
What's that, David? Carbon dioxide, you mean?
Carbon dioxide levels in a room. Yeah.
Yeah, I mean, carbon dioxide, we all use it. Uh, but, it's a crude surrogate, if you will, for outdoor air provision to a classroom. And I say that crude in that, there are many advantages in that it's simple to do and what, but there are, behind all of that, there are quite a few assumptions that have to be met to be more accurate and with what you're reporting and what those levels actually mean. And what I mean by that, you have to assume that you've got good calibration. You've got
I lost your audio for a minute, Richard.
to assume that you hear me now?
Yes, I can now. Yes.
Okay. Yeah. The point being that when you're taking carbon dioxide levels in the classroom, that is for a single zone operation. So
Okay.
in other words, it works well if you have a dedicated system that's serving a classroom. Now, if you have, which often we do, we have multi-zone operation in a school. You have to understand that the empty classroom next door or down the row is going to influence the levels that you're recording in, say, the occupied classroom. So that's one of the assumptions that we often overlook and say, hey, things are fine. You might make the assumption that things are wonderful here, but in fact, what you're doing is you're getting the mixed air from the other classrooms where you don't have occupancy. So, long story short, we could go into all the caveats. Carbon dioxide is a great kind of initial tool. And so I think it's a surrogate that you could use to approximate ventilation. But, it's not exact. And,
Sure.
and to meet all those assumptions, you typically don't in a normal school. So we
Got it.
do what we can with it. Understanding that you don't, you have to take all the other factors into account, and then what are you left with? How do you make your decisions based on that?
Mm-hmm. So the loading, the density or concentration rather of CO2 in adjacent classrooms in these multi-zone systems can influence it. So would it be safe to say that testing at different times of the day in different loading situations can give you would be a best practice in that case, so you're not relying on a single snapshot?
Oh, sure. If you're taking carbon dioxide walkthrough measurements are truly a snapshot. And, I mean, seriously, the only way to get meaningful carbon dioxide data is to take real-time data. So you're logging data over a period of time, and you're looking at that as a data set as a whole.
Got it. That's the gold standard.
Yeah, typically carbon dioxide concentrations are going to they're going to increase throughout the day. And if you were lucky in a perfect world, you're going to meet what we call a steady state or an equilibrium value. Often that does not occur. And so the assumptions directly tying carbon dioxide into the amount of ventilation are tied into you meeting steady state. What I mean by that is that carbon dioxide level has to level off in the classroom for it to be meaningful. Now, the problem with that is that within the 6-7 hour occupied day within a classroom, you may not meet that equilibrium. And so as such, you are overestimating the ventilation rate when you are assuming you've reached equilibrium, and in fact, you've not. Um, and that happens quite a bit as well. So, uh, it's one of these things. If you're above a certain level, in the past, if you're above 900 to 1,000, depending on what your outdoor levels are, parts per million, you say, hey, things are not great here. We could do better, right?
Okay.
But if you're below that level, you really don't know. You don't know. You say, I've got to look at it closer. And the reason is that it might be occupancy is variable. You might have economizers kicking in that typically would not on a routine basis. There may be some sort of uh, caveat, something that you have to take into account for that given day that may be influencing and drawing those CO2 levels lower. So if you're above a certain value, hey, I've got to fix that. If you're below it, you need to look further to really feel like you're doing the right job.
Got it. That tees up very well this next question, which is thresholds. And that's what we're kind of looking for, is very specific data points that are accessible and useful, so that we can then talk about the next steps is what do you do when you start to get outside these range. And you mentioned, below about 1,000 parts per million. And that's kind of what we've been looking at is a target range, acceptable range being about 1,000 to 1,200. Is there in your opinion, a specific number? Is it 1,000? Is it 1,100? Like, well, how much does that even matter in determining what your acceptable threshold is?
Well, what that's a difficult one because what are we talking? Are we talking past, present, or future? And those really play an important role. 1,000 used to apply, but 1,000 applied to the minimum, and I'm saying minimum, recommended minimum, that ASHRAE says you should, essentially 1,000, somewhere in that range. You should meet that as a minimum. Now with COVID, we're no longer looking at maybe providing the minimum. We're trying to exceed that. And often I get asked the question, what should you exceed it by? Well, typically you're limited by your system. Okay, so it's wonderful to go out and say, hey, let's bring in 100% outdoor air. That's great, and you could do that in certain climates and certain systems. It's very popular in Scandinavian countries and where you have displacement ventilation. You've got low flow outdoor air coming in,
Mm-hmm.
exhausted, as you have thermal gradients rising that to be exhausted at the ceiling. So, that works well under those circumstances, but uh, not always here in the United States can you do that. So what we try to do, really, what we try to do is optimize, right?
Sure.
I mean, that's it. We're trying to optimize our system. You do what you can do within the constraints of the system. And so I love to hear these, and I'm sure you all do too, these, uh, whatever you want to call them, platitudes. Yeah, bring in 100% outdoor air. Is that real world? Can you do
Yeah.
that with our system? No, you can't. Think of a hot, humid climate. Oh boy,
Mhm.
you're going to be replacing one problem with another if you cannot handle the latent load. Um, and so, uh, so I don't know if there is an exact value that you could say at this point what we should be trying to meet.
Mhm.
Definitely, we should be meeting minimum standards, but we try to exceed that.
Got it.
Do the best you can.
Got it. So, what would you say would be when do we pass through the gray area from minimally acceptable to no longer acceptable? And then some follow-up questions from there about outside air and strategies. So, what would you say would be, is it 1200 ppm? At what point where you start to say, okay, we're out of the minimally acceptable and now we need to do something? Or is it,
Yeah,
go ahead.
yeah. I mean, you want to try to provide. Nowadays, we're trying to look to at least 4 to 5 air changes per hour. I
Okay.
mean, that's really what we're trying to achieve. That and again, that's one of those things that may not be may not you may not be able to accomplish that. In doing so, your CO2 levels are going to be associated with that. They're going to be down around 700 parts per million
Mm.
under those circumstances. So um, that's where you begin to look at the data and say, can I do better? Can I bring it down less than 1,000? Certainly above 1,000, you're not cutting the mark. You're not doing a good job. Don't feel there's any exact delineation uh, because as well, all of this, when you look at CO2 levels indoors, it depends on what your levels are outdoors.
Okay.
And so, in the past, you look at approximately whatever outdoors is, and you add 600 to 700 parts per million to that, and that is your acceptable level for indoor. Um,
Mm.
that assumes you've got good calibration. That assumes the instruments are reading properly. Um, um, that there it's just you have to take all these things into account, David. It's not as cut and dry as we'd like it to be.
Got it. Got it.
Yeah,
Okay.
and this goes back to what I was saying. A snapshot in time. You could, hey, if you walked into a classroom and you got 2,500 parts per million, bam, hey, you're not doing your job.
Right.
Walk in there otherwise, and you get some lower values. You want a data set, maybe throughout a week, 2 weeks, and you're looking at that and analyzing, is it consistent? Do you have multi-zone operation? Are the other classrooms that are tied into the classroom that you're looking at, do they have similar occupancy? In a perfect world, that'd be great if you did. Then you could rely on those values more. But yeah, nowadays with COVID, uh, it, I I hear more and more. 700 parts per million. We're going to try and keep it below that. May or may not be feasible, but That's what some districts are trying to do.
Okay. And 700, is that, tell me where that number evolves from.
That has to do with how many air changes you can provide. Again, if you're in a typical classroom where you have 15 to 30 people in there, if you're providing 4 air changes, something along those lines, you'll 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 be looking at concentrations of about 700,
Okay.
800 parts per million.
Okay, thank you. And so I'm going into some of the questions that are coming in the chat and some of the comments, and then kind of get into some mitigation strategies and some of the sort of human impacts that you can help us inform here on these different levels. So one of the questions was coming up about outdoor air. Is there some sort of guidance that you could give us in terms of a number or value for outside air that we can present as a minimum viable necessity for safe occupant safety and clean air, or are you thinking, is it the air exchanges or outside air? How could you help us think about those things?
Well, 15 cubic feet per minute per person.
Mm-hmm.
That's kind of, it's about 13 to 15 when you look at ASHRAE standards. It falls into that as a minimum. And if you, if you, the levels of CO2, you can of course, you can calculate how many CFM per person you're getting. And all you know is the generation rate. You have to know the equilibrium concentration of CO2 in the classroom. And there are simple equations to lay out very quickly what you get in terms of CFM per person. 15 has been what we've had in the past, 13 to 15 CFM per person. I'm not sure that applies anymore right now. There's a wonderful model out there. There are actually a couple. Andy Pursley at NIST. I'm not sure how many of you know Andy. Good friend, outstanding researcher at the National Institute of Standards and Technology.
Oh,
He's
sure.
worked so much on carbon dioxide and ventilation. And he'll tell you in a heartbeat, using CO2 in a school is not perfect. It's far from perfect.
Mm-hmm.
But at the same time, he describes in very simple terms in some of his papers how you come up with, how do you relate CO2 levels to the amount of fresh air you're getting per person. And I don't have the reference for it, but I'll tell you what I could do, David, is try and get my hands on that and send it to you.
That'd be great.
But it's pretty simple, straightforward. And they also have a model called FATIMA. That's FATIMA. Andy and Lisa Ng from NIST put that together. And what it essentially tells you is depending upon what you're providing in terms of outdoor air, some of the risk factors associated with transmission of the disease within a classroom, which is nice. Again, it's not exact, but it gives you an indication of if you do, if you provide, say, so much ventilation, or I think it also covers air cleaning to a point.
Mhm.
It tells you, depending on how you modulate that, what the risks are associated with transmission. Now, to complement that, there's a wonderful, wonderful model that has been put out by Rich Corsi.
Mhm.
Rich Corsi is outstanding researcher, used to be at University of Texas for so many years, and now he's at Portland State.
Mhm.
And that is called Safe Air Spaces. Safe Air Spaces. And I'd strongly recommend you Google that, find
Okay.
the website, look at it, and what that does, it takes into account, it's a layered risk approach to dealing with COVID. And it means, okay, if you have one infected person in the classroom, they might be a low emitter or a high emitter, depending upon the person itself and what they're doing in the classroom. But it will tell you, okay, what if I mandate masks? What if I don't mandate masks? What if I mandate masks and I increase ventilation to a certain point?
Mhm.
What if I add an air cleaner? All of those things. Now, neither one of those models I just mentioned take into account cleaning and disinfection, which none of us ignore that. In fact, our research is heavily focused on that right now in schools,
Mhm.
in terms of what people transmit by direct contact and surfaces. So, but the model, the Safe Air Spaces model, does give you some wonderful information. And I'll tell you, it is as simple as can be. You look at it, self-explanatory.
Mhm.
You just play with it for a while and you'll find out how useful it is. Uh, it even gives you it says go to a certain bookmark and you look there and it'll do calculations of cubic meters to cubic meters per hour to say cubic feet per minute. Yeah,
Mhm.
it does it all for you, and it lays out the assumptions of what went into the model. And last I was working with Rich, and we did a webinar on this. Rich did the webinar, and I was working with him on the webinar on the Q&A. They had a version 1.0, but he said he was very close to 1.1, which will be even more user friendly.
Great. Well, I appreciate that because simplicity and user friendliness is key to being implemented, as you know.
Oh,
That's
it really is. And these are great models. And I'm not sure how many people know about them.
right.
It'd be interesting. I wondered how many people on the line know about that. You but it's certainly worth looking into.
Well, we will look that up and we'll send it. I'm sure some of the folks on the call are familiar with it, but we'll send it to everybody in the email. Maybe does jump to an extreme, and that is one of the questions that bubbled up lots of times is, at what point do you stop using a space or you consider it unsuitable to be in either a space or a school, uh, given different IAQ considerations and metrics? Like, when do you say we've crossed a red line?
Yeah, what can you do? And I'm sure all of you face that. Face that. If you have a space, and there are so many in schools that are equipped with older systems that are not going to be commensurate to the new kind of shift, if you will, to be able to maximize outdoor air. And even if you did maximize outdoor air, it would be severely limited. I mean, look at many systems still run off of chilled water, heated systems, it's like fan coil units. I mean, without any introduction of outdoor air. That's a situation where you have to take some measures. Now, what do you do there? This is a point of contention. I wouldn't say contention, but controversy. You can open windows, okay? Well, a lot of points related to opening windows. So what do you do there? Say you open a window and you do have some sort of system, mechanical system, and if you're bringing in some degree of outdoor air, you may actually, in many schools, you are pressurizing the building. If you open a window, you're simply disrupting the mechanical system. You're disrupting the ability of the system to control temperature. And I'm not saying not to do this. I'm just saying that there is no assurance you're going to get more outdoor air in that situation. So, and we've done a lot of studies related to what quote unquote naturally ventilated classrooms.
Mm-hmm.
The problem with that, naturally ventilated classrooms can mean a lot of different things. Unless you have good cross flow in the classroom, you may not be getting anything coming in and out of that window. And some of the worst schools I've looked at were in the Netherlands and in Scandinavia, in Finland, in terms of ventilation, where they relied on windows to be bringing in outdoor air. I just want to say that reliance on that alone, that's you're kind of shooting in the dark. You may be doing better, you may be improving, but you may not be helping a great deal. The other thing is, what do you do? You've got limited capacity, ability to bring in outdoor air, or it's not bringing in outdoor. You could bring in air cleaners. Okay, now in the age of COVID, what we're looking at aerosols, and we consider those particulate of sort, and such that air cleaners will address that. Air cleaners are not a surrogate. I mean, they are not a replacement for ventilation. But when it comes to removing viral particles or agglomerates thereof, which typically is really what we have, you don't have viruses just floating around.
Right.
Air cleaners can do a decent job of reducing that. So that's an option that could be looked to. But even at that, you have to determine, okay, will the air cleaner be effective? We wrote a paper back in 2006 on effectiveness of portable air cleaners. If ever it applied, it applies right now at this point in time. And it's a means of looking at the air cleaner itself and how do we compare them? And then what does it mean in terms of lowering the load in the classroom? And in this case, we're talking about aerosol or particulates in the air. So air cleaners could be looked at. But again, that's not the, in a classroom, COVID isn't the only reason we ventilate. We ventilate to bring down levels of VOCs and so many other things as well, and for aesthetics and odors and whatnot. So, and some of the air cleaners, they'll have a thin kind of layer that's carbon coated, but it's very, they're not intended to last long. So you're not going to get, the carbon isn't going to be highly effective in removing odors over a prolonged period of time.
So So
I'm telling you, there are options.
okay. Yeah. And that's kind of where we're getting to, like, what are some of the strategies to remedy? I know Jerry and Bob on the call specifically have contributed some thoughts to that. So please, you two and anybody else, you just kind of jump in on this in the chat, or if you need unmute, feel free as well. Just a quick follow up on that, and then kind of opening the floor some more. So the in-room filtration units, which of course are a hot topic. A lot of people have gone out and bought them. A lot of people are trying to sell them. What I'm hearing as a layman in this conversation is yes, it is a strategy that can work depending on the unit for removing particulates from the air in like the aerosol format that we're worried about. But I didn't hear that it's going to do anything in terms of CO2 levels. So we are filtering, we're not ventilating. And
That's right.
is that an accurate way to say it?
Yeah, and I just see a comment someone said, then there is the noise.
Right.
Yeah, it's a very important point. All of these air cleaners are rated on, when you see a rating on an air cleaner on the side of the box, typically it's what we call clean air delivery rate. And those clean air delivery rates are set at the highest fan level for that unit. Okay, so the best it's going to do is when you turn that on full blast. And many of these air cleaners are very, they could be annoying in a classroom situation where you've already got so much noise going on, and teachers don't, often you see systems shut off like unit ventilators and what, simply because of the noise.
Mm-hmm.
That's going to happen with air cleaners as well. But I mean, air cleaners certainly have a role. They're not going to impact the carbon dioxide,
Mm-hmm.
but it complements in terms of reducing the risk of transmission, because you're lowering um, the infectious agglomerate in the air, what it might be. Now, so, but that as well, the other misnomer or misconception about air cleaners is that they're always going to work no matter what, to some extent. It's really not true. And we detail that in the article we wrote so many years ago, in that air cleaners, to be effective, they have to be able to compete with natural removal processes. What I mean by that, what I mean is that if you have somebody sneezes and you have an agglomerate coming out from that, which is full of all sort of, bacteria and saliva and everything, where you have the virus mixed into that, that's what we call droplet. And droplet transmission is important, but it does fall out of the air within a much shorter distance.
Mm-hmm.
But then we have the aerosol fraction that we've demonstrated is so important, that does remain in the air for a longer period of time, up to hours and then some. So if you were trying to remove droplets with an air cleaner, it's not going to happen, because in fact, gravitational forces are much greater than the ability of the air cleaner to deal with that. The other thing is, if you had 100% outdoor air, you've got a lot of fresh air. Air cleaner is going to have to be able to compete with that. And if you cannot compete with your outdoor air, it's not going to do any good. So optimally, air cleaners are used where you don't have the ability to bring in a lot of outdoor air, okay? But they're not going to be, if you're already ventilating as best you can, they may not be as effective as you would hope they would be. And
Well,
that's important to understand.
that's interesting. Forgive me for just jumping in there, because we just said is that they're not going to be as useful and when you have, sufficient outside air coming in, but best when you don't, and yet not improving, ventilation and CO2. I think that goes back to one of the, the threshold questions, which is, obviously, as you know better than most, a lot of us here, the condition of a lot of our schools on IEQ and other things is deplorable. And one of our key sort of guidance questions is, at what point do we say, if you can't get below X measurement over Y period of time doing Z different strategies, you need to, you shouldn't have people in here. How can you help us think about setting that bar?
I really can't. I mean, that goes back to it's not just ventilation.
Mm-hmm.
It's cleaning, it's masks, it's cleaning, disinfection. I mean, masks in their own right, you're really addressing 60+% of trying to reduce the problem. You do a lot with mandating masks.
Mm-hmm.
It's not perfect, but that's a good way to go. I just, nothing's set in stone because, you masks are going to be taken off and put back on. They're not going to be worn right. Air cleaners, they have short circuiting. They might have all sorts of problems. And by the way, with air cleaning, this one thing, tried and true is a HEPA air cleaner. There's nothing fancy about it. You know what I mean? High efficiency,
Yeah.
air. And in fact, there are makeshift HEPAs out there right now that being sold at a low cost, certain websites. There's nothing really tricky about it. It just works. I'll put it that way.
Mm-hmm.
Now, there's so much being sold on ionization, needlepoint ionization, bipolar ionization, etc. And ionization traditionally, historically, has not been as effective as we would like it to be with reducing particulate load in the air.
Okay.
And in addition, when you have that, when you're generating those ions, it's very possible you're producing ozone,
Mm-hmm.
if not designed properly. And it's difficult for a novice, someone to look at a system, because of all the hype related to these systems, you go, wow, this must be the greatest thing ever. It's not. When you ask for the hard data and you want to look for that, you're an independent party, preferably a university or someone that's taken a scientific, rigorous approach and journal publications to back that, which you're going to have on established air cleaners. If you don't get that, there's something missing. And to rely on anecdotal information and testimonials, you're really sticking your neck out there.
Mm-hmm.
And I would recommend avoiding the unknown and going more with what you know for certain is going to do the job.
The
Now,
tried and true, as you said. And one of the comments that came in related to that, and then maybe moving off of these indoor filtration units, is placement. Air flow and air plume. Important to consider in this. It would seem, again, from a layman's perspective. How would you advise folks to think about who have purchased or are purchasing these in-room units about where to put them in the room and why?
Well, okay, a lot of them have, yeah, I mean, I love talking about air cleaners. I could go on and on about it, David. Okay, again, if in the selection of the air cleaner, make sure you just, if you're doing it for COVID, buy the basic HEPA unit. You do not need all the indicators and the lights and everything coming on. Some of the air cleaners have air quality indicator lights. That's going to cause you nothing but headaches. These are typically put on their sensors that are not highly accurate, and they give you a general idea of air quality, but it may not be pertinent to viral loads, and typically it's not. So that may cause you headaches. So you want something more basic, just understanding that you're going to have to change out the air cleaner, the filter itself with time. But in terms of placement in a classroom, as we all know, you can design the best system in the world, ventilation system, and within a day, an occupant can defeat that system by obstructing the return, obstructing supplies, depending on where they're located. All sorts of simply not understanding the functions of the ventilation system itself and how important it is not to use a unit ventilator type of grill as a bookshelf or cover it up. So with an air cleaner, you're looking to, if you had your druthers, you'd put it in the middle of the classroom. That's not going to work, and we know that. So you want to face it out toward the middle of the classroom. So I would not put it in an unstable position up on a counter where it might get knocked over. You want to make sure it's stable. You want to make sure it's unobstructed. You want to run it at the highest level possible with taking into account noise. And there are many of the air cleaners do provide some degree of low noise parameters related to them. You can look at the Association of Home Appliance Manufacturers has their list of, it's not mandated, but they have their list of air cleaner manufacturers that subscribe to the standards, and they'll tell you how many decibels are related to the air cleaner at different settings. So you look to that, and again, you try to maintain it. Those are the best things you can do related to use of an air cleaner.
Got it. Okay.
Could I ask David? The question was, I've read in a couple of different sources. This is Bob Coral, a couple of different sources that where the unit is placed in the room can oftentimes pull a plume towards that device and thereby increase the risk of whoever is nearby that device over what they would be in a room where the flows are more turbulent throughout the room with normal ventilation. In other words, if we put it next to the teacher's desk, the teacher could have an increased risk of, if somebody does have a viral plume they're ejecting, that it moved to the teacher.
Yeah, I mean, that's why I'm trying to get to, Bob. If you're trying to place it, probably on the perimeter of the room, and away from, I mean, you don't want it right next to an occupant because you're going to have currents. You're going to have some drug. If you're turning these things on as high as can be. You're also going to have it blowing out. So that's a very good point. Whether or not you're actually increasing the risk, I haven't seen a lot of data on that, because at the same time you're cleaning that, and you should have directional airflow to the air cleaner. But if you had a very high volume air cleaner, that would mean you could disrupt certain airflows within the classroom, and you might have that kind of wind tunnel, or whatever you want to call it, that directional flow coming across people that you wouldn't want. But I think your benefits far outweigh any detriment with using an air cleaner.
So to use in a small space, you're probably going to have better overall benefit anyway, considering the amount of volume that you would need to move compared to a larger
That's right.
space.
You may need more than one air cleaner in a classroom if you're following the prescribed room limitation, or they have a recommendation in terms of room size. But as Rick Scorsese once said on the webinar that he and I were doing, also, you may not reach maximum levels of reduction to be afforded by an air cleaner. Like when we look at criteria related to air cleaner in a standard realm, we look at an 80% reduction. When you see room size on an air cleaner, that means that before you put it in to the new equilibrium that you're going to reach, you get an 80% reduction in particulate. You may not reach that if you don't have the size limitation. You're not matching it directly to the size. Say, for instance, your classroom is 700 square feet and it recommends this is good for 450 to 500. Doesn't mean you may not get an 80% reduction, but you may get a 60% reduction. That's still significant. That's still worthwhile looking into. I just wholesale though, Bob, I would say, and to all of you, buying an air cleaner is not a bad thing. It is a supplemental approach. We all know that. It's not a primary replacement for ventilation. And remember, at the end of the day, you're introducing, I think they are very applicable in classrooms where you do have limited amounts of ventilation that you could bring in. But say across the board, to put them in every classroom in a school, you're not only going to have an initial cost, you're going to have a replacement cost that is significant related to the filters. And those filters typically need to be changed out every 6 months to a year. And in a heavily densely occupied classroom, you may be closer to having to change it out every 6 months. So,
it's really helpful information. Thank you.
right.
Dr. Shaughnessy, guy listener here in Idaho, we have an enterprising vendor selling needlepoint bipolar ionization units.
Yeah.
I've been completely unable to find any research on the process. What do we know? Where can I look?
Well, actually, there's a lot of research on bipolar needlepoint ionization. In the generation of the ions itself, that's the concern, where depending on how they're doing that through corona discharge, you're going to form some degree of ozone. So, again, if you cannot get the data, I would steer clear. If I said blanket wholesale, walk away from these things, the next thing you know, I'd have lawyers at my door.
No, understood.
I'm not going to do that. but I can tell you to look for the valid data, and often, more often than not, you're not going to find it with respect to those air cleaners. And if you're looking for it, and you can't find it, and they cannot provide it to you, the onus shouldn't be on you. You understand what I mean, right? The onus should be on the manufacturer that are selling these units. And remember, testimonials, anecdotal, isn't worth the paper it's written on.
No, understood. And that's what we've been receiving from them is either that or internally generated research from the manufacturer, which I consider to be equally suspect.
Well, and we are closing in on time, so we could take a few more minutes, but I don't want to overextend the time too much here. Dr. Shaughnessy, as we're kind of wrapping up, and folks pop in something in the chat if there's a burning question we want to get out here before we close. We're talking about the in-room filtration as a way to capture airborne particles in the time of COVID in particular. Once the pandemic, we move through this and we're getting back to something that will be normal again in school instruction. As I've been listening to you and listening to others for the past year, we've got CO2 and sort of cognition and cognitive functioning and health. And then we've got the concern of airborne illnesses, and that those exist in parallel. They're independent of each other, is from what I understand. And as we start to move out of this mercifully in the next, hopefully 6 to 12 months or sooner, how can you help us think about, sort of from an operation standpoint, from a budgeting standpoint, budgeting for these things like HEPA filters in our rooms versus replacing our HVAC systems centrally and updating those versus but passive solutions like you're opening windows. You mentioned just from a CO2 level. I guess, to put succinctly, the question is, how do we think about the risks of CO2 as we get higher than 1,000 parts per million? What kind of risks are we talking about to the occupants as that gets higher? What kind of benefits as that gets lower, conversely? And then secondly and succinctly, as we get out of this pandemic, what kind of prioritization and budgeting do you think you could advise facilities directors to think about relative to improving ventilation and CO2, and improving ventilation and decreasing airborne pathogens?
It's quite a end question. I'd like to
High level only. I understand. That's another hour, but
I'll leave that to Jerry Roseman to answer for you sometime. Let me just tell you that you brought up a lot of points there. CO2 has been cited and continually does, related to effect on cognitive ability. We don't quite understand that yet. I mean, the research has been only in the past decade where we picked that up, and what I mean is that now we think of CO2 as not an indicator of ventilation, but maybe CO2 as truly a pollutant load that can affect our ability to think properly, to deal with. So, so there are good papers on that, so the effect on cognitive ability is one thing that we'll probably hear more on. There's even some concern about people wearing masks and buildup of CO2, and right there, because of the mask inhibiting their exhaling. properly. The other thing about CO2 is I just don't know absolutely what number to tell you. I hate to, you know, I've probably given you more questions than answers, and I hate that. I really do. But based on our experience in schools, there is no, yeah, someone just said they stuck a CO2 monitor, yeah, under their mask and they had 10,000. Yeah, yeah. But CO2 it's a good indicator. But remember, that's all it is. It just is something that is telling us something about ventilation.
Okay.
Ventilation is the end point, and that's what we're trying to maximize. We're trying to do better. I do not think you say when all this is said and done, we're not going to go back to what we had before. There's an awareness level. People are concerned, and we're going to be looking to exceed ASHRAE levels by 30% plus in many schools, or we're going to total displacement type systems. And the last thing I want to say about CO2, and boy, I'll tell you, I don't want to cause a storm here, but I am not a strong proponent of just passing out CO2 monitors to teachers and students and say, go about your school and see what you find and this. The problem is that it could be misinterpreted. People think, oh my gosh, I'm above a certain value. We need to evacuate the school. We need to get out of here. I'm being poisoned. It's toxic. And without education going along with that sort of program, you know, you may be creating more problems for yourself. And there are so many assumptions that go into carbon dioxide. It's not a yes, no. It's not a black, white type of answer with CO2, as we've already mentioned. So I would advise caution if you're taking that approach and bringing in teachers and staff. You want to keep them informed. You want to educate them, but just throwing CO2 monitors out there, are they calibrated? How precise are they? How accurate are they? The drift, everything related to CO2 monitors are a nightmare. And often I take these CO2 sensors in schools, I go outside and they're like reading 900 parts per million outside or 50 parts per million outside. These things aren't calibrated. I mean, what good is that? It's no good whatsoever. So many things to consider, David. Again, I'm raising more questions than or things to consider. I'll leave it at that.
Had to do it at least once, talk on mute. I said, that's good. That's called education. I had a dean once tell a master's, you're now leaving this place knowing less than when you came. And for that, we are grateful. That was a good,
Okay.
good way to put it.
Okay.
But anyway, I again appreciate the time, and maybe that's a good sort of last quick question. Is so what do we look for then in the assessment? How would you provide an outline, or what kind of outline should we be looking for to get a good indoor air quality assessment? If, you know, as you said, CO2 is a blunt instrument and a relative one at that, given different conditions. So what would constitute a good assessment that we could look at?
Take a look at this paper from Andy Pursley.
Got it.
And you could Google Andy and you'll find these papers.
Okay.
But he breaks it down. He simplifies it in terms of what the CO2 values tell you with respect to schools. Okay. And I'd strongly advise you to start right there and pick that up. That will tell you what you're dealing with. And like I said, Andy would if he were on here, he probably would say use caution definitely when taking CO2 values. Understand the assumptions and then begin to relate it to ventilation.
Okay.
And, can be done, and if done properly, you get a good idea of what's happening in the school. I mean, I learn something every day I'm in a school, and I never cease to learn new systems, new operation, everything about it, what's going on, and now we have COVID. So it's like we're constantly trying to adjust, and that's our role. It's
Right.
old, but one that we have to take up.
Right. Well, I think we're a few minutes, 10 minutes past, so I think we bagged enough time from everybody here, and so I think we'll cut it off there. But I really appreciate it, and again, some questions to follow up on, not the least of which is 10,000 parts per million of CO2 under Bob's mask. I have to drill down to that one a little bit, but. So thank you very much. We will look at those citations that you gave us from Corsi and Percy and do some quick reading of those and send some information out to the folks here on the call. Thank you very much, everybody, for your questions, for your commitment to this conversation, and Dr. Corsi for being here with us. And we will carry on. And as we start to develop the different draft guidance documents here, we'll be sending it out to everybody for your review and comment to make it better. So have a great rest of your day, everybody. Thank you very much. Thank you, Dr. Shaughnessy.
Thank you. Take care.
Much appreciated.
Thank you. Thanks, Bob.